Hello. So today I'm going to demonstrate how to administer safely inhaled medication. For this technique, you need hand sanitizer, aero chamber with or without a mask, and the medication. So first of all, you're going to perform hand hygiene. Now, before each medication administration, make sure to perform your 10 rites of medication administration for each medication that you're going to give to your patient. Once you're done with your 10 rites, you're going to go into your patient's room, introduce yourself, and check your patient identity. So you're going to ask them for their name and date of birth and confirm with their ID bracelet. You're going to teach them about the use of the medication, the reason why they're receiving that medication. Now, depending on the patient that you have, you may use only the meter dose inhaler, or you can use an aero chamber. If you're giving two different medications, make sure you always give the bronchodilator first. The bronchodilator is opening up the airway, so it makes the second medication better absorb. So if you start with the bronchodilator, you want to make sure you shake it first for 2 to 5 seconds. If it's the first time your patient is taking that medication, you have to do proper teaching. So Mrs. Carey, today I'm going to teach you how to use your meter dose inhaler. So you have to always shake it first. You can remove the mouthpiece, the protector of the mouthpiece. You're going to have a good seal around the mouthpiece. And when you're ready, so you're going to exhale normally. Then you're going to put the inhaler around your lips. You're going to activate your puffer, and then you're going to breathe in for 3 to 5 seconds. Okay? Once your breath is in, you're going to try to hold your breath for 10 seconds or as long as you can. So you inhale 3 to 5 seconds, you hold it in for 10 seconds, and then you're going to exhale through pursed lips slowly. Okay? This is going to facilitate the absorption of your medication. If you have to take multiple puffs of your medication, make sure you wait between 30 and 60 seconds between each puff. Same thing, if you have to take a second medication after this one, you have to wait at least 1 minute in between each medication. If your patient is unable to use the meter dose inhaler directly, you might want to use an aero chamber. So the aero chamber, what it does is that it makes it easier to take the medication. So when you remove the mouthpiece, you can insert it at one extremity of the aero chamber. The patient will have to seal their lips on that mouthpiece here. And when you're going to activate the puffer, the medication is going to stay in the aero chamber. Once the medication is in, the patient can actually take 2 to 3 breaths to inhale the medication. Then same thing, they hold their breath for 10 seconds and they exhale through pursed lips. So they shake the medication, they attach it, they're going to seal their lips on the mouthpiece, exhale normally, activate the puffer, inhale for 2 to 3 breaths, hold their breath for 10, and then exhale through pursed lips. If they're unable to have a seal on their lips, you can use an aero chamber with mask. Again, same principle. You insert it, oops, and you're gonna make a seal with the mask. And the technique is the same. So they exhale normally, you activate your puffer, they're gonna inhale for 2 to 3 breaths, hold their breath for 10, and then exhale through pursed lips. Once they've taken their medication, you wanna make sure that they rinse their mouth with tap water. And that is especially true if they take corticosteroid, because if they don't, they might develop thrush in the mouth. And the same For the inhaler themselves, they have to clean the mouthpiece with soap and water, and also the airway chamber should be cleaned after each use with soap and water. And don't forget to sign your MAR and to document your intervention.